Hello, and welcome back to the Transform Wellness Podcast. I'm Dr. Bradford Perkins, a metabolic and longevity expert. Today we're going to talk about optimizing testosterone. Low testosterone affects 30% of men aged 40 to 79. However, I'm seeing a lot more low testosterone in younger men in their 20s and 30s. There are several reasons for that, and we're going to get to those in a little bit. On average, there's a decline of about 1.6% in testosterone per year of life. And, between the ages of 25 to 75, you see a 30% decrease in total testosterone and a 50% decrease in bioavailable testosterone. But the scary thing is the mean testosterone in the labs is going down, and it's gone down about 150 to 200 points just over the past 20 years. And there's many causes for this, and it's not aging. So what happens when a man has low testosterone? It causes frailty, reduced lean body mass, reduced muscle strength. It can increase total body and central weight gain. It can reduce cognitive function. You can have decreased libido, erectile dysfunction, mood changes. You can have an increase in insulin resistance, increase in cholesterol, and poor athletic performance, and overall increase in mortality in studies. Women, it's a little different. Women with low T tend to have fatigue, muscle weakness. They also have increased cardiovascular events in some studies. Problems with sleep, reduced libido, weight gain, can lead to fertility issues and irregular periods. It can lead to a loss of bone density and, again, increase in mortality. So when we're looking at primary hypogonadism, that's the term for low testosterone that's caused by testicular failure. We're going to look at just aging in general, trauma to the testicles, chemo and radiation in the area. If you had an undescended testicle when you were younger that was pulled down in childhood, that can lead to that testicle producing less testosterone. Varicoceles, which are veins in the scrotum that heat up the testicles too much, leading to decrease in testosterone production. And there are certain heavy metals like lead and cadmium, which can lower testosterone. Then we look at secondary hypogonadism, meaning we're having low testosterone because of other aspects in the body. This is where most of the low testosterone I'm seeing in younger people is coming from. So just having chronic stress and high cortisol levels, that inhibits testosterone production. So stress, high stress jobs, lots of stress at home does lead to lower testosterone. Just having more fat cells, so obesity in general, because testosterone is converted to estrogen. Insulin resistance also can lead to low testosterone. Poor sleep, sleep apnea, that leads to low testosterone because a lot of testosterone is produced at night. High prolactin, this is a hormone made in our pituitary gland. This can be due to stress, medications, and rarely a benign brain tumor that gets picked up. So always have a prolactin checked if you're having your testosterone being low. And then opioid pain medication also decreases testosterone. Head trauma. Having too much iron, that's a condition called hemochromatosis. Certain chronic illnesses like liver disease, chronic kidney disease, HIV, those can lead to low testosterone. Just in general, metabolic inflammation, which everyone has these days, it seems, many different causes for that. And then there are SARMs. Now, this is more these young men, maybe late teenager, early 20s, that are doing SARMs because their friend says, let's do it at the gym. If you do that too much, it does suppress your testosterone. And in general, overtraining, not getting those proper rest days leads to low testosterone. For women, age does play a role. As women go through perimenopause and menopause, testosterone does go down. If you have your ovaries removed, that lowers testosterone. And actually, birth control pills also lower testosterone. As far as lifestyle, poor diet and nutrients, not enough zinc, not getting your vitamin D or boron, magnesium, having too much alcohol or drug use, And then there's these endocrine disruptors, these toxins in our environment, which are plastics, BPA, phthalates, and the pesticides on our food, all lead to low testosterone. And then lack of exercise can lead to low testosterone. And we also mentioned overtraining can lead to low testosterone. And having a low fat diet, because our hormones are made from fat. So this whole thing where everyone needs to be on a low fat diet, it does affect our hormone production because we need those fats to make it. Then there are medications that can lead to lower testosterone, like prednisone, statins, because they're decreasing cholesterol. Beta blockers, which are blood pressure medicine, may interfere with hormone production. Certain antidepressants can affect metabolism. Finasteride, which some men take for hair loss or enlarged prostates. And then there's the drugs that can raise prolactin. Those are some medicines like Seroquel, Reglan's and nausea medicine, some of the antidepressants, birth control pills, opiates, which are like oxycodone and hydrocodone, and THC may raise prolactin, lowering testosterone. So what test should I have? So initially, I recommend a total testosterone, a sex hormone binding globulin, and a free testosterone. That can be just checked at Quest or LabCorp or your local lab. But if for females, they should have a different test. It's a total testosterone that is an MS, not an IA. IA is immunoassay. That's fine for men, but for women, that's not good enough. You need the MS, which is the mass spec. For optimal range, there's so many different optimal ranges out there. This can be quite controversial. But for men, I'm shooting somewhere between at least 650, max 1100. Women are going to have a normal range between 14 to 30. If it's over 45, that's higher. We see that in women with PCOS. Under 14, that would be considered low. And then for free testosterone, depending on the metrics, I like to see a free testosterone between 90 to 168. Now some labs it's going to be 9 to 16.8. And for women, a lot less, 2.26 to 4.5. But if we really want to get a comprehensive workup, I want to look at all the different sex hormones and things that are going to affect hormone production. So I want to get a DHEAS, which is a precursor that makes testosterone. I want to see an estradiol. That is mass spec for men. I want to see if you're over-converting. I want to see an LH, which is your luteinizing hormone. That's made in the pituitary gland. So if that's really high, that's where we see that's primary hypogonadism we talked about earlier. If it's low or normal, then it's secondary. So I see a lot of men, they're in this low normal LH, and the doctors have just put them on testosterone. Sure, you could do that, but it's not really treating the underlying cause. And that's what we want to do, is try to correct it without needing to take testosterone replacement for several years. I want to look at a prolactin level, a CBC, an iron, a metabolic panel. Got to check a PSA. You want to look at your insulin and A1C. You want a full thyroid panel, including TSH, free T3, free T4, thyroid antibodies, and maybe a reverse T3. Getting just an AM cortisol, a serum test. For some people, we need to do a 4-point salivary cortisol test. That's if I think it's due to a lot of stress. So if someone has a DHEA that's really, really low, that tells me it's related to stress. So I'm definitely looking at that stress response. I'd check an IGF-1. That's a growth hormone. It helps look at growth hormone, see how that's working. It's not an exact, but it's what we got. And then some of the micronutrients like zinc, magnesium, vitamin D, and homocysteine. So how do we help testosterone naturally? So just going to go in no particular order. Optimize sleep. Because 75% of testosterone production occurs during sleep, mostly REM sleep. So if you're a person not getting enough REM sleep, we need to be able to support that. So we want to see 7 to 9 hours of quality sleep. You want, cool, dark room helps. Have blackout curtains. No blue light for about 1 hour before bed. So you might get blue light blocking glasses. You're changing out your alarm clocks. There's different techniques for blue light. That's on a different talk on here. And then supplements, you can do magnesium, melatonin, honokiol, something called Ziziphus. So those can help with sleep. Managing stress, because that's what I see. This is why these first two are here, because most people aren't sleeping enough. Most people are overstressed. So simple things that you think is just too simple really does make a difference is daily breath work. That can be box breathing for 2 to 3 minutes, 2 to 3 times a day. That helps kind of calm down the inner body, calm down the hormones, try to get into that rest and digest nervous system called the parasympathetic nervous system, help calm down the cortisol response. Strength training helps with stress, and there are adaptogens, which are traditional herbs like ashwagandha, rhodiola, holy basil. L-theanine is also very calming. Optimize nutrition. So you want to make sure you're getting enough protein. So depending on where you're at, I want at least 1 milligram per kilogram of protein, maybe even up to 2 milligrams per kilogram of protein. And if you're over the BMI of 25, that's your ideal body weight in kilograms, not your total body weight. And the reason why I want to get a lot of protein, the higher number is for people that are lifting a lot of weights. You just need a lot more protein. Low glycemic index foods, anti-inflammatory foods, that just helps with inflammation, getting the blood sugar down, getting foods that are rich in zinc. Those are oysters, beef, pumpkin seeds. Boron-rich foods, this is a trace element. That's avocados, raisins, walnuts. You want to get your cruciferous vegetables. That's like broccoli, cauliflower, because that helps with our body's detox. And then there are certain supplements that can help if you need them, like zinc, magnesium, vitamin D3, and omega-3s. Then insulin resistance, I don't even know what the number is currently. I think it's over 50% of Americans have insulin resistance as long if they're adults. So looking at a low glycemic index, glycemic load diet, so watching out for those sugars and refined carbs, eating more complex carbs, which are your vegetable sources of carbs. You want to optimize your insulin sensitivity. That can be with exercise, that's with diet. That can be with certain supplements like magnesium and chromium, berberine, people talk about alpha lipoic acid, and something called PQQ as well. And then strength training. You want to work out those big muscles. So if you're not someone that's exercising, you want to do things with squats and deadlifts, get the glutes, the quads, the hamstrings. Those are our biggest muscles. You want to do compound lifts, which are lifts using multiple muscles instead of isolating it. So don't just do like a leg extension machine. Squats, split squats, much better. You're doing HIIT, high intensity interval training, 1 to 2 times a week, about 20 minutes. And doing some level 2 cardio most days of the week is important. But once you're getting into that endurance cardio where you're exercising 1+ hours a day doing cardio, that's where people can start to get low testosterone. So if you are a person who loves to do your cardio, or just in general when you're exercising, do the strength training first, then do the cardio. You get a better response with testosterone. And for the endurance athletes, I do recommend taking some type of supplement to support your testosterone, like tonkata leaf, fenugreek, or shilajit. Those are some good supplements that can help. And then detox. Why are we talking about detox? Because we take our hormones, we need to break them down, get rid of them. But if we're backing up our toxins that are from our metabolism, it can cause damage to the body. So we don't want to do that. So, cruciferous vegetables, again, help with detox. You want to watch the toxins. We talked about the plastics, the phthalates, things like that. We want to limit alcohol, because anything that's going to burden the liver. So some of us, just our genetics make us poor detoxifiers. So we want to make sure we are optimizing our detox just to get rid of the toxins as well as our hormone metabolites. Certain supplements can help with detox, like glutathione. That's our master antioxidant. Alpha lipoic acid, keolic garlic, N-acetylcysteine. Those actually help make glutathione in the cell and have other benefits as well. But so you don't just take all of them, you just pick one. DIM, or calcium D-glucarate, that's for high estrogen levels, and milk thistle helps support the liver. As far as other support, you can do intermittent fasting, cold plunge. And there's a really cool machine called the Vasper machine. It was produced by NASA, I believe, where you can do these HIIT interval trainings with cold. I've done it once. It's amazing the feeling you get when you do it. Now, as far as how do we treat testosterone? So if it's a secondary cause of testosterone, we need to treat the underlying cause, not throw testosterone replacement at it. So if it's stress, we want to support stress. If it's poor sleep, we want to work on those lifestyle issues we just talked about. If there's medications, then we look at clomiphene to try to restart the brain telling the testes to make more testosterone. And clomiphene is compounded, and HCG injections is another option. But if it is truly primary low testosterone or primary hypogonadism, then testosterone replacement therapy may be warranted. And there are some contraindications to testosterone replacement. That's active prostate cancer and breast cancer. Prostate nodules or unexplained PSA elevations. If your hematocrit on your CBC is over 50. If you're a person with unstable congestive heart failure or severe untreated sleep apnea, those are the people who should not take testosterone. When it comes to the ins and outs of, does it increase your risk of prostate cancer? The latest studies say no. Does it increase the risk of cardiovascular disease? The latest study says no, even though there is a black box warning that was put on, I believe, back in around 2017, 2018. But the latest study does not show an increased risk. But this is a conversation to have with your primary care doctor. Once you're on testosterone or you're on some of these other medications you want to recheck, you do want to get a testosterone with a free testosterone about 6 weeks after you start or after each dose adjustment. And then if everything's stable, every 6 months. Reason why I don't shoot for over 1,100 is the studies, at least for cardiovascular disease, aren't for people with these 1,800 testosterones. I can't tell you when it's super high what your risk of cardiovascular disease is. If you're a person doing topical gels, you want to do the blood test about 2 hours after you put it on. For injectables, you want to do it the day before your injection. You may consider doing a peak about 24 to 48 hours after your injection. You want to follow your PSA, especially initially. You want to check that hematocrit every time because I do see people getting higher and higher hematocrits where they have to do bloodletting and get blood out. You do want to follow prolactin levels and check your estradiol. So thank you for your time. I hope this is very informative. Please subscribe to my channel if you want more tips in the future. If you have any questions or experiences, drop in the comments, and I hope everyone has a great day.